Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. You know, an estimated 30 million Americans age 40 and older live with bothersome overactive bladder symptoms. Patients with overactive bladder may have to rush to the restroom frequently because of an urgent or sudden need to go, like I have. And it may impact their daily activities. Here to talk about the condition and how it affects and what to do about it is urological nurse practitioner Diane Newman from the University of Pennsylvania Penn Center for Continence and Pelvic Health Division of Urology. Welcome to our show. This is a problem for a lot of us. And actually, I want to welcome you to our show for much needed help. Welcome to our show, Dr. Newman. How are you? Or not doctor, Nurse Newman, right?
Yeah, well, yes. Thank you very much for having me.
Okay, you're welcome. You know, why is overactive bladder a concern for people who have this condition?
Well, it's very prevalent. Over 30 million Americans, 40 and older, have the condition. We mostly see it in women, and it's a very embarrassing condition for women, which is why I'm here on the behalf of Astellas, you know, to raise awareness. So I really thank you for having me.
Oh, no problem at all. And if you've ever experienced it, you know what you said in the beginning, that it can be crazy, especially if you're not near a bathroom anywhere, right? So
no, you're right.
Go ahead.
No, you're right. You know, some of the symptoms, you already stated one of the symptoms. You know, what women tell me is that they have bladder urgency, where that gotta go feeling. They're rushing to the bathroom. They go frequently, which is more than 8 times during the day. And they may have urinary incontinence, which is unwanted urine leakage. So like you say, it can be really disturbing to really do your life with overactive bladder.
Right. And, you know, sometimes you may have an infection too on top of it, and it makes it even worse, right? Am I correct?
Sometimes you can, but overactive bladder can be just its own condition, and it's caused by, you know, an inability to control your bladder contractions.
And right, maybe your bladder's swollen as well. Is that true? Could that be
women? Yeah, and you're talking about fallen bladder. That could be a prolapse. Some women have that, but again, those may be symptoms and problems that you have with overactive bladder. But overactive bladder in itself is a problem that many women, you know, start to experience, especially as they start to go through menopause.
Right. And what are some of the statistics surrounding the number of people who have OAB?
Well, over 30 million Americans. I mean, it's more common than you think. And the problem is that women hide it. They're very embarrassed by the condition. They don't want to tell their friends, their partners, their family members, because it's very embarrassing. And a lot of times it's noticed by family members that someone's, you know, their sister or their mother is always rushing to the bathroom. And a lot of women will state they can't make it there, and they may have what we call urgency incontinence on the way to the bathroom. So it can be quite a devastating problem.
You know, what are some of the things you can do to treat this condition? This is the most important part of it, right?
Yes, it is. Treatment's there, and that's why I tell men and women, please go seek out your healthcare provider and consult with them about options for you. But, you know, there are treatments, and there's some simple treatments such as changing your diet. There's certain things that in our diet that we may drink or eat every day that actually irritate the bladder. One of the most common things are caffeine. Caffeine's in coffee, tea, soda, and sometimes, you know, if you just eliminate or cut down on the amount, like maybe the number of cups of coffee you're drinking, you really will decrease your overactive bladder symptoms. There's also strategies to control bladder urgency, that gotta go feeling. There's also pelvic floor muscle exercises or Kegel exercises, which, can prevent urine leakage. So there really are treatments available, and that's the message I want to get out. If you have the problem, don't live with it. Seek out some type of healthcare provider, your routine visit, talk to them about your overactive bladder symptoms.
Let's talk about the Kegel exercises, because I remember doing that and it really does help. Can you explain it? And is there a place that you can look to see or talk to your doctor? Because I know when I went through it, I had to learn how to do the exercises, and they really do work, and it's not hard. And you said men and women. So men have this problem as well as women. Am I correct?
Yes, men will have the problem. Sometimes it's due to an enlarged prostate. But yeah, there are treatments. Pelvic floor muscle exercises. We have a pelvic muscle in our pelvis, and by identifying that muscle and using that muscle, you can really prevent urine leakage. You can also use the muscle to really control bladder urgency. But there are other treatments also. But the most important message I think we want to get across is don't live with it. Don't be embarrassed by it. Really seek treatment. One of the options, and one of the things that I tell patients to do, and I tell women and my friends who may have the problem, is keep a diary. We keep diaries if you're on a weight loss program as far as tracking how much food we're ingesting. Keep a diary about your bladder habits, like when you go to the bathroom, if you have urgency, if you may have some incontinence, and then what you're drinking. And then take that diary to your healthcare provider and consult with them about maybe options to help you with overactive bladder.
Would you suggest a urologist or a regular doctor, Diane?
Whoever your healthcare provider is, your primary care physician, if you're seeing a nurse practitioner, I'm a nurse practitioner, so that's maybe someone. Because in addition to what I was telling you about some of the more non-invasive treatments, there's also medications. And medications help the bladder store urine. So, there's many options for overactive bladder. Also, there's information on copingconfessions.com that you can go to and learn more about overactive bladder.
And that's really important as well. And I saw some of your beautiful films that you do, and it just reminded me about, being in the car and gotta stop now, and that's the thing. Do you suggest drinking, so if you're not drinking caffeine, what about water? Does that help or hurt?
Well, you should drink enough fluids. One of I think the bad habits that people get into who have overactive bladder is they stop drinking because they think if they don't drink, they're not going to make any urine, so that the bladder won't become overactive, and that's not true. I worry about, with what we're going through now, about some of the essential workers like nurses. I have women who tell me that they go to the bathroom every hour, every 2 hours. Can you imagine that if you're a nurse in the ER or in the ICU and you have all that, the gown, the PPE on, the mask, and of course the goggles, to protect your eyes, and then you have an overactive bladder and you have to go to the bathroom every hour or 2 hours, you have to remove all that PPE kind of equipment. I can't imagine it. Or if you're in retail and in a grocery store and you have that urgent feeling coming on, I really feel for these women, and it's very embarrassing, and it's, they really hide the problem. So the message really is, it's a bladder condition. Please seek out your healthcare provider and talk with them about your problem.
Would you give that website out one more time, Diane?
copingconfessions.com. Excellent resource.
And thank you so much for joining us today on Kathryn Raaker's World. Thank you. And Let's Just Talk Radio. Thanks a lot. Have a wonderful day. Thank you.
Thank you.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. The holiday season can be a joyous time of year, marked by good food and celebrations with family and friends. But it can also be a hectic and stressful time for many people. Research shows that holidays can be particularly challenging for the nearly 1 in 5 Americans who are living with pre-existing mental health conditions. One common condition that can be impacted by stress is bipolar disorder. It is estimated that there are 2.5 million U.S. adults will suffer from bipolar disorder at some time in their lives. Today, family psychiatric nurse practitioner Dr. Jessica Whelan is joining us on behalf of AVI to share advice for navigating this unprecedented holiday season. Welcome to our show, Doctor.
Hello.
Welcome, Doctor. Can you tell us, how can the holiday season impact people who struggle with their mental health?
Yeah, so actually 64% of patients with mental health conditions report that the holidays actually make them feel worse, which is why I'm excited to be here on behalf as a compensated spokesperson on behalf of AbbVie, hopefully to spread awareness and help others differentiate as to whether they may be struggling with something like holiday blues or whether they may be having something more specific like bipolar 1 disorder.
What is bipolar disorder and what are the symptoms?
So bipolar 1 disorder is a chronic health condition. It's actually characterized by having high and low mood swings. The low mood swings, which last at least 2 weeks, these can actually be misidentified and frequently are misdiagnosed as major depressive disorder because the symptoms can overlap. These periods can be feelings of depression, having sadness, fatigue, low energy, may have less interest in your hobbies. There may be changes in appetite. But what sets it apart is the manic episodes. These last somewhere to about a week in length. This is increased energy. This energy may not be a good energy, though. It can actually be irritability. It could be increased anxiety, trouble finding that sleep that you may want to find, increased risk-taking behaviors. During the holidays, this may actually be exhibited as spending extra money that we may not have, which is problematic.
And for those who have been diagnosed with bipolar disorder, can you share some advice to help manage their condition during this unprecedented holiday season?
Well, I definitely always say start with opening the dialogue with a healthcare practitioner. I think it's very easy to write off the symptoms of a health condition and say, oh, that's nothing. But it really could be something. So I would definitely start there. But if it's the holiday blues, obviously that's only going to be self-limited to the holidays. Bipolar disorder is going to happen throughout the year. So it is going to be characterized by having symptoms that happen outside the holidays.
How can this holiday impact people who struggle with their mental health? And how do we help them, Doctor?
Yes. So for patients, like in my practice, I do like to recommend quite a few techniques. Mindfulness is one of those things. And one thing you can do is doing mood charts. You can get those online, but in a day of technology, we can even get them on our smartphones. I do like people to include their family members, though. This helps decrease stigma and bring in others on our care planning. Also, with self-care, making sure to get those 8 hours of sleep and not working 16-hour days, which I could probably be better at myself. But getting on the right medication treatment is something that's exceptionally important. And a medication that has been effective for my patients with bipolar 1 disorder has been Vraylar or cariprazine. It is a prescription medication that is FDA approved for adults with depressive episodes and for the short-term treatment of manic and mixed episodes in bipolar 1 disorder. Something to keep in mind, though, is that all medications can come with side effects, and so these would need to be reported to a healthcare practitioner. To keep in mind, this is not a medication that is approved in the elderly with dementia-related psychosis. That population is at higher risk for cardiovascular side effects and stroke, so we would want to give increased warnings to them. Children and young adults with any kind of depression-related treatments are at higher risk for suicidal thoughts, and so we want to also monitor them more closely. Anytime you'd have stiff muscles or changes in muscle movements, anytime there are gastrointestinal side effects or nausea, those would all need to be reported to a healthcare practitioner if you have any side effects with medication. Obviously, if you want to learn more about tools or side effects with medication, this medication in particular, you could go to the website www.vraylar.com.
Where can people go for more information, Doctor?
That website again is www.vraylar.com.
Thank you for joining us today. Thank you for your mission and what you do to help people during this time of year and other times of year to manage their systems. Thank you so much.
You too. Stay healthy.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. When a chronic disease kept him from pursuing his dreams as a race car driver, Chris Arthur set out to find the right doctor to help manage his condition after years of navigating the ins and outs of living with ulcerative colitis. This Hollywood stunt performer, athlete, and devoted father is here to share his story. Chris joins us now to explain why it's important to keep searching for a solution while never giving up your dreams. Joining him is Dr. Arthur Kornbluth, clinical professor of medicine at Icahn School of Medicine at Mount Sinai and in private practice at New York Gastroenterology Associates, to talk about inflammatory bowel disease like ulcerative colitis and strategies for managing the condition. Welcome to our show.
Thank you.
Thanks for having us.
Dr. Kornbluth, what is ulcerative colitis? And how can it impact patients?
Okay, so ulcerative colitis is itis, which means inflammation, just like bronchitis, laryngitis. In this case, it's itis of the colon, which is the large intestine. The only job of the large intestine is to absorb water. So if it's not absorbing water, it's not doing its job. We're going to end up with looser, watery stools, diarrhea, and unfortunately sometimes bloody diarrhea. If the colon's in spasm, we're going to have abdominal pain. And this is an inflammatory disease, and it can infect the whole body. We can have weight loss, we could have fevers, we could have inflammation in other places. And with its sister disease, Crohn's disease, there are 3 million people in the United States with this disease. And maybe you never heard of it because, in fact, a lot of people don't want to talk about it. This is not a cool disease to talk about with diarrhea, pain. So this is important as a patient, if you're having the onset of these symptoms, to recognize that this might be ulcerative colitis and get in to see your physician early so we can start treating it appropriately early on.
Chris, can you tell us a little bit about yourself and when you were diagnosed with ulcerative colitis?
Absolutely. I was initially diagnosed with UC at 19 years old, and it was a pretty debilitating disease for me, and unfortunately put my life on hold. And I was not able to continue to pursue the things that I wanted to professionally and personally. The thought of having a family someday was not a reality. The thought of pursuing my career in racing or being able to do stunts like I do today, those were not even something I could contemplate at that point. It was just really a time and period in which I'm just trying to survive an atrocious disease. And today I work as a stunt performer in movies and television, and I have 2 beautiful children. So I'm very fortunate I've gotten over that hurdle, and I couldn't have gotten there without the help, the guidance, the support, and the proper care that I received from Dr. Kornbluth. So working with him, getting the best possible treatment plan put in place has allowed me to live a pretty incredible life. So I'm really fortunate to be working with Janssen, with Dr. Kornbluth at this point, years later, and getting to share this story of conquest and moving forward and being able to overcome the worst of the disease that I dealt with for many years.
And Chris, how did your relationship with Dr. Kornbluth change your experience with ulcerative colitis?
Dr. Kornbluth was really pivotal in my experience with colitis, in getting from a point where I was terribly ill to getting to a point now where I live a pretty remarkable life. when I first saw him, I was in really bad shape. I had lost a tremendous amount of weight, and I just wasn't doing well. And I kind of didn't have a lot of hope either at that point. And I had seen some other physicians, and they didn't have a lot of a very positive message. They didn't really listen very well. And although it was just a passing moment for him, most likely, for me, it was just a really impressionable, important moment where I knew that my course was going to change. And it was partially because of the confidence that he instilled in me. And he said, look, I'm going to get you better. And ultimately he did. And I knew at that point when he said that my life would someday be what it once was.
Dr. Kornbluth, how did you approach working with people like Chris to manage their condition?
Well, I think it's key to put it into context. Chris's colitis might be very different than Susan's colitis. Chris was sidelined about his dreams of becoming a race car driver, which he ultimately accomplished. And it's very hard to talk to a patient like Chris, or maybe a patient like Susan, who's a 55-year-old kindergarten teacher who has to worry about running out on her 5-year-olds. Every patient's colitis can impact them in different ways. It's very important. On the one hand, we have to tell patients this is unfortunately a chronic, lifelong disease, and they'll probably need to be on medications for their lifetime, perhaps. So while we tell them that, on the one hand, we need to really offer them hope. And fortunately, we can, because the great majority of patients, we can get well of these years because we have so many biologic drugs that have become available just in the last 4 or 5 years. We have more new biologic drugs in the last 4 or 5 years than we had cumulatively in the last 50. So we have the ability to get patients well. It's our job to get patients well to not their new normal. They should be back to their old normal. That's really what we're able to accomplish most of the time. And to look for that patient's particular goals, dreams, and aspirations. Unfortunately, these days with our medications, we really can do that.
And Chris, what's the key to finding the right doctor?
I often liken finding the right doctor to dating. And for me, it wasn't the first date I went on. It wasn't the first doctor I saw. It took a while. It took a couple tries. And I think that's an important message to pass along to other patients, is that you can get to that point and find the right doctor that you can have faith in, have good communication with, and get the right treatment with. But it might not be the first doctor you see.
Chris, do you have any advice for other patients with ulcerative colitis?
Absolutely. Just stay the course and stay positive and hopeful, and seek out a doctor that works well with you, and seek out the proper treatment plan, and hopefully you'll get to where you need to be so that you can live the life that you want to live.
And thank you for joining us today on Kathryn Raaker's World.
Thanks very much for having us. Thank you.
Hi, this is Kathryn Raaker of Kathryn Raaker's World, and let's just talk. You know, people don't usually have to worry about minor bumps and bruises, but for those with a rare bleeding disorder, experiencing bruising or bleeding after something as routine as minor fall can be alarming. In recent years, important treatment development have brought hope to people living with hemophilia, and many may have a new outlook on living with a chronic condition this coming holiday season. Here to talk about an approach for managing this disorder are hematologist, oncologist Dr. Amy Shapiro, co-founder of the Indiana Hemophilia and Thrombosis Center, and Guy, who is living with hemophilia. Welcome to our show, Dr. Shapiro and Guy.
Good morning.
Dr. Shapiro, what is hemophilia A, and how many people does it affect?
Hemophilia A is a rare genetic disorder where individuals who are affected, their blood does not clot normally. People with hemophilia bleed longer and commonly into joints and muscles. And if it's not controlled, it can lead to long-term joint disease and chronic pain. Bleeding can be life-threatening if it occurs in a vital organ. About 20,000 individuals are affected in the United States. And because this is a rare disorder, I still hear many misconceptions about the disorder itself and individuals who are affected with it.
Guy, what has your life been like living with hemophilia A? And what challenges have you faced?
Being diagnosed at birth, I haven't known much other than hemophilia. So little things as getting cut while shaving or doing dishes, cooking have been a challenge. But I go to the hospital every day, almost of the week when I was young, getting treatments, about 5 days a week. And then home treatments became available. And I'm being legally blind, I'm not able to see my veins, so I had a Metaport put in, like you'd have for cancer treatments, and didn't have much luck with that. So when a new treatment came along, I was the first one to raise my hand and be in line to try it.
Dr. Shapiro, what can you tell us about the change you've seen in this patient community thanks to the advances in treatment for patients like Guy?
Well, for people living with hemophilia A, until a few years ago, the FDA-approved preventative medications were all administered into a vein, or what's called intravenously, up to a few times a week. Now, people with hemophilia A can have an option called Hemlibra, which is a prescription medication used to prevent or reduce the frequency of bleeding events. And this is the first medication that for hemophilia A is administered as a shot underneath the skin, which is also called a subcutaneous injection, like insulin. It can be administered at home after either the individual with hemophilia or one of their caregivers has been trained. Hemlibra, like all other medications, does have some side effects, some of which can be serious, like excessive clotting or thrombosis, but this is usually only in individuals who are utilizing a specific other medication on top of Hemlibra. So it's important for people who consider this medication to speak to their treating physician.
Guy, what led to your decision to try a new treatment?
A couple of years ago, I decided to go back to try college a little late in life, and going to film school, carrying around a huge camera, and having bad joints due to hemophilia was probably the wrong choice. And when the option became available for the new treatment, I realized that I didn't have any bleeds anymore, and I was able to carry around a camera and walk and not have a bleed and be able to have a life again and be able to do things that I wasn't able to do before. Being able to treat once a month instead of every day, it's nice.
Dr. Shapiro, where can our viewers and listeners go for more information?
There is information available on the internet. There's a website called hemlibra.com, which has more information. And I do want to thank Genentech for partnering with us to increase awareness about this disorder.
And thank you for joining me today on Kathryn Raaker's World and Let's Just Talk Radio.
Thank you very much for having us.
Thanks so much.